Alzheimer's disease, more properly about dementia, because Alzheimer's disease is just a subcategory of dementing illness. And there are lots of different causes of dementia. When we talk about dementia, we're often talking about older people, but it can occur at a young age too. Some hereditary Alzheimer's or some hereditary dementias can start in the 30s and 40s. But when we talk about dementia, we think about people losing primarily, initially, their short-term memory. They have trouble remembering things that happened recently. They have less trouble remembering things that happened long, long ago. So when you're talking to a demented patient, it's often easy for them to recall what happened in their teenage years or in their 20s or 30s, but they have trouble remembering what happened yesterday or earlier in the day-to-day. And that's kind of the hallmark of a dementing illness, recent short-term memory loss. Now, there are a lot of deficiency syndromes that can contribute to memory loss. Vitamin B12 deficiency, for example, is one that's often overlooked. Patients have pernicious anemia, they don't absorb vitamin B12, and it affects brain function and a lot of other functions, and supplementing B12 will often correct that. There are infectious diseases that can cause dementia. Diseases like syphilis, for example, and diseases like Lyme disease, and diseases like AIDS can cause a dementing illness. So there are infectious problems that can cause it. There's a number of hereditary syndromes, Pick's disease and so on, that can cause a dementing illness. And there is a big category of people who have dementia because of vascular disease. They've had strokes, often a series of very small strokes. So that's a subcategory of blood vessel problems, atherosclerosis, that causes the dementing illnesses. And then there are things like hydrocephalus, which can cause a dementia and ataxia and urinary incontinence, which is a hallmark of that particular syndrome. But Alzheimer's disease is a subcategory which doesn't fit into any of those. The disease is characterized by tangles of proteinaceous material forming in the brain, and the only way you're ever going to see that is on a brain biopsy, and that's rarely done. The diagnosis can be made on clinical grounds, and it can be made also sometimes with MRI scans that show certain typical changes in the brain of Alzheimer's disease, but they're not absolutely diagnostic. It's usually done on a clinical basis. And we don't have any specific treatment for Alzheimer's disease. There are a couple of genetic markers that can be tested to determine whether we don't have specific treatment for Alzheimer's disease. And we don't also have specific tests in most cases that will determine it. There are a few people who carry genetic markers that can be tested for, but this is rather rare. Patients who have Alzheimer's disease and dementing illnesses, other dementing illnesses, in some cases you can treat the deficiency syndrome. In some cases, as in the case of hydrocephalus, you can shunt the brain's high pressure, and that'll relieve some of the symptoms. In some cases with the vascular dementias, you can control atherosclerosis with drugs that lower cholesterol and drugs that prevent clots from forming in the brain and stop the progress of the disease. But Alzheimer's disease has no specific therapy. We do have some medicines that help it a little bit. A couple of drugs that have become available in the last 10 or 15 or 20 years that help stimulate the brain to work a little more efficiently. Drugs like Aricept and Namenda can be used very carefully. Sometimes they're overstimulating and have to be very carefully monitored. Also, depression and depressive illness can masquerade as dementia. And if you can identify patients who are really depressed and that's part of their memory loss pattern, treating the depression can help them a lot. So if you feel like you or one of your relatives is beginning to develop short-term memory loss, it's very important to get to medical care right away, because that dementing illness might be correctable in the case of a vitamin deficiency syndrome, or might be correctable in the case of a hormone imbalance of some kind, like thyroid deficiency, that can cause dementing illness, or it might be stoppable in terms of progression if it's a vascular disease disorder. And in any case, if it does turn out to be Alzheimer's disease, it can be helped and slowed with current modern medications. Thank you.